Assalamu alaikum and good morning. On the behalf of organizers, I, Dr. Maria Khan, welcome you all in the hybrid seminar on contemporary global mental health. This lecture is organized by Sindh Innovation Research and Education Network Siren in collaboration with International Center for Chemical and Biological Sciences, University of Karachi. This seminar aims to address disparities in care between resource-rich and resource poor countries, focusing on the needs of communities at highest risk. It also seeks to understand the interplay of social, environmental, and biological factors that influence an individual's mental health. So with this, I would like to request our respected teacher, Professor Dr. Raza Shah, Director, International Center for Chemical and Biological Sciences, to share his thoughts.
Good morning and assalamu alaikum, ladies and gentlemen. It's a matter of great pride for us that we are having two eminent and genuine in the psychiatric society, Professor Dr. Iqbal and Professor Irfan. Professor Iqbal, we are in brotherly relationship. I always called him as my elder brother, and so he is beside a good psychiatrist, good medical doctor, but an excellent human being. That's what I have seen in him, and it is our blessing that we have such a credible, such excellent doctors who are not only taking care of the patient, but who are also contributing in the education and the development of the young doctors in the country. His contribution is enormous, and he played a very important role to just popularize the psychiatry in the country. And Professor Irfan is actually here spending most of his time, exclusively his time in outside Pakistan, and but his specialization is actually child psychiatry, and he will be more talking about that one. This is the area which is very much ignored in Pakistan. You know that normally the psychiatrist, whenever you ask someone that you need to just consult a psychiatrist, then the people think in a different way. It's not acceptable. Our society is still not at that level to accept that this is a disease or this is some malfunctioning of our biological system. So there is a great need that we can just realize the importance of psychiatry, and we can just educate. We can educate our young people that it's imperative that it is not only this is not something which we shame. You have an issue because you know that our brain, this is actually our whole body is like governed by our brain, and it is our every system in our body is under the control of our brain. So if a single neuron or something is happening, and these neurocells, they are talking with each other, and if there is a miscommunication in this talking, then it's just becomes some illness, and that's what they have to treat. So this is, this is, we should accept that this is actually a malfunction of the body, and we should accept that there are treatment, there are ways to deal with this, and this is and this kind of lecture is important in that sense that if once the most important is that we should just accept the reality that this is the reality, and that is and for that such kind of gathering and advocacy that these are curable diseases. This is a, and we need to just adopt better lifestyles, and that's why when I was told that Professor Afridi and Professor Irfan, they have some time. So I was extremely happy, and I asked Nadine that immediately just arrange their lectures on this very much important topic, which is neglected in the country, but still being an educational institution, it is our duty to just educate our young people and provide a platform for such kind of interactions with the peoples. And with this, once again, thank you very much for being with us here. And we are very much looking forward for the wisdom which you have acquired over the years to be shared with these young students. And still, there are many people they would be joining online, and there are several auditoriums across the country, since this is a focal point for the rest of the country. So many people do attend the lectures in their own auditorium, and they are live telecast there in this from this room. So with this, thank you very much.
Thank you, sir. Now I would like to request our first speaker, Professor Dr. Muhammad Iqbal Afridi, to deliver his lecture entitled Investing in Mental Health for Global Well-being.
Bismillahirrahmanirrahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. Sadaqallahul azim. Ladies and gentlemen, first of all, I'm very thankful to all of you for sparing time, and I'm especially thankful to the organizer, our own great scientist, Professor Azasha and Professor Nadeem, who has given us this opportunity to talk about this important area. And I'm also thankful to our worthy second speaker, Dr. Irfan Ali, who is a child and adolescent consultant, child and adolescent psychiatrist working in Ireland. And when he comes to Pakistan, he always spare time for the educational activity. Acha, meri awaaz sahi? Everybody can hear properly? Okay. So, as you know, investing in mental health for global well-being, if you look at the global level, there are a lot of turmoils going on. And they are really very painful, like in Gaza, if you have seen in Bosnia, then Kashmir, Afghanistan, there are a lot of turmoils are going on, which are really impacting our mental health. So the investing may just not mean to invest money, but we'll talk about what other things we can invest. So before embarking on my presentation, let me clarify that it should be informal talk so that we can learn from each other experiences. You can ask me any terminology if you don't understand. So the WHO has given very good definition of health, that health is not merely the absence of a disease, but is complete physical, psychological, and social well-being. And now, what are the components of physical health? The component of physical health are anatomy, biochemistry, and physiology. And what are the components of social health? The person should be fit in the family, in the community where he is or she is residing, and in the organization where he or she is studying or working. If somebody is not fit in that community or organization or in team, like in cricket team, if you may be playing very well, but if you have no compatibility with your colleagues, he can uh, drop you, he can out you. So therefore, it's essential for us. And the third, the mental health components are three: A, B, C. A means affect, which means emotion, jazbat. B is behavior, which means action, and C is cognition, which means thought. उर्दू उसकी क्या होगी? सोच से ज्यादा का फहम, समझ, वकूफ। वकूफ एक्चुअली इसकी उर्दू, जो बेवकूफ से बे हटा दें, दैट इज वकूफ। So when WHO was given this task to redefine the mental health, they were not able to properly define it. They just came with single sentence after a lot of debates for weeks that mental health is broader than lack of mental illness. यानी ज़हनी सेहत ज़हनी बीमारी की अदम मौजूदगी से कहीं बढ़कर है। क्या बढ़कर है? That's but luckily the World Federation of Mental Health has given very good definition, which is so according to that there are four components of mental health. It is a mental health is a state, number one, in which each and every individual realizes his or her potential. What are my capabilities and what are my deficiency, so that I can overcome my deficiency and improve my capabilities. इसकी मिसाल ऐसी है कि unfortunately in our country when some kid is failed in maths, the people exert all efforts on maths and his natural talent is ignored. That should not be done. For example, अगर वकार यूनिस से मैं बैट्समैन बनाता नहीं बना पाता. So therefore, number one, and number second is can cope with daily stresses. Number three, can work fruitfully and productively. इसकी उर्दू क्या है कि मुफीद और समरमंद काम करे. And number four, can serve his community and country. अपनी सलाहियतों को बरूए कार लाते हुए मुआशरे में एक फाल किरदार अदा करे. If somebody is not contributing to his family, community, country, and global level, he is, according to this definition, is not mentally healthy. And you know, when this criteria was applied on UK citizens, how much of them fulfill this criteria? Well, any guess? 13% of the people fulfill this criteria, and the rest of said, no, सुबह हो जाती, शाम हो जाती, जिंदगी उन तमाम हो जाती. I don't know what will be the ratio if you yourself see the four criteria that कि अपनी सबसे पहले अपनी सलाहियतों का अंदाजा हो, रोजमर्रा के मसाइल से नब्बर आजमा होने की सलाहियत रखता हो, मुफीद और समरमंद काम करे और अपनी सलाहियतों को बरूए कार लाते हुए मुआशरे में फाल किरदार अदा करे. तो अब देखिए, look at the most of us are not doing or fulfilling all these criteria. And while mental illness is a condition where thinking, feeling, or action are disturbed. Now, what are the indicator of good health, good mental health? A person should be having empathy, resilient to stress. Like in our country, is very good. How very good resilience. इतनी मुसीबतें आ गई हमारे ऊपर अफगानिस्तान पाकिस्तान में, and they are still going on. Optimism, flexibility, spirituality. While the indicator of mental illness are that the person is either having disturbance in sleep, relationship, mood, and all these things. Now, coming to the actual wellness. Now, wellness is now has been given nine dimension of well-being. So what are the nine dimensions? Starting from physical and the environmental, financial, social, emotional. Now they have added creative wellness. You should be creative. Acha. Look at the spiritual health. Most of our politicians are lacking in the spiritual. What is spiritual? Purpose and meaning of life. क्या पीपल मीनिंग लाइफ ये है कि प्लाटें बनाओ, स्विस अकाउंट में पैसे जमा, कब खाओगे? बट अनफॉर्चुनेटली उनसे ज्यादा हमारी जो है इंटेलेक्चुअल हेल्थ खराब है, कुछ हमारे अवाम की. वाई हमने चुना इन लोगों को, हमने उनको रोका क्यों नहीं? लास्ट टाइम जो कराची में बल्दियाती इंतखाबात में 18% लोग ने पार्टिसिपेट किया, वोट डाला, बाकी सोते रह गए, छोड़ो तब. What that means, our intellectual health is not good. That's why ये फजूल लोग हमारे ऊपर फैसले करते हैं, which lead to what? Which lead to नेचुरल डिजास्टर से इतने लोग नहीं मरे जितने मैन मेड डिजास्टर से लोग मरे हैं. सॉरी, this is the natural disaster, and this is the chemical, nuclear, and biological, and what has done in the country. क्या इराक में वाकई ऐसे वेपन थे जो 15 लाख लोग मारे? That was a wrong decision of man-made disaster. So therefore, apart from that, the natural disaster also linked to our own abnormal behavior. हम जो उल्टे सीधे गैस फलां करते हैं, that is also leading to natural disasters. So therefore, we have to select such people at the high level who are good decision makers. And I know Raza Shah Saab, he is really a gem. A lot of opportunity was given to him to go back to the Switzerland or other country. Like he has decided to serve the country. इसी तरह से we have, if you are not serving your country and community and family, you are not mentally healthy. So why mental health and well-being is important? This is important because healthy lifestyle lead to a lot of achievement. If you are a student, if you are a worker, you can have good performance. Similarly, better physical health, improved recovery from illness, higher education attainment, greater productivity and creativity, and better relationship, increased social cohesion, and improved quality of life. ये नहीं है कि बस पहले कहते थे मेरा बच्चा फेल नहीं हो, फेल अगर 33 नंबर दे दिए तो क्या हो, तीर मारा. सेहत की महराज पे जाना चाहिए. पास होने की महराज क्या है? A1. तो इससे अल्लाह ताला ने, गॉड हैज गिवन अस द कैपेसिटी कि जो है हर चीज कर सकते हैं. आप 30 सिपारे याद कर लेते हैं. एक आलम से मैं मिला, आई कैन स्पीक 6 लैंग्वेजेस इंक्लूडिंग सिंधी एंड पश्तो. एक आलम से मैं 75 कंट्रीज को, सब 75 लैंग्वेज आती थी. साहबजादा याकूब को 9 लैंग्वेजेस आती थी. तो therefore we are underutilizing our mental capabilities. Now coming to the economic, what is the relationship of economy? If you look at the economy of a country and global level, 35% of economy is related to mental health. If you improve mental well-being of a person, his performance at school, at work, everything will be all right, because he will contribute to the community, country, and so therefore economy, 35% economy is related to mental illness, and the budget is 0.04% in Pakistan, which is spent on mental health. Mental is a vital component of every person overall well-being, and 1 in 5 is having actually a problem. पहले कहते थे 4 में से 1, अब कहते हैं 1 in 5, and most of the illnesses start at younger age, and this lead to limiting opportunity fulfill life. Because if somebody has developed, like for example the next slide, if you see at this slide, most of our psychiatric and mental illness start here from 10 to 30. So therefore, if the person is in school, his performance will be bad, so therefore he may not be a very successful person. If the treatment opportunity, prevention is opportunity is given, he can be very good person. Like for example, if you recall, John Nash was a schizophrenic patient. He was a patient, he was suffering from schizophrenia. A film है A Beautiful Mind, and he was, उसकी बीवी ने ख्याल रखा. He was a mathematician, and he was given Nobel Prize because he was taken care by her wife. So therefore, rehabilitation is having a lot of potential in the psychiatry. Now, these are the various psychiatric illness, and the most common is depressive disorder, anxiety. These illness start from 15 to 50 years, and they disturb our performance because this is a productive age, and they are very common. This side is male, and this side is female. Female are double suffering from depression. Why? Because of their biological reason, every month and after 45 menopause, and then they are more capable to describe their feeling in words. They are more capable. And number third, society is not giving the due respect and status which should be given. एंड नंबर जो वो है कि बच्चा है बेटा है उसका खबरदार रोना नहीं है मर्द का बच्चा बन तो उससे क्या होगा नशा करेगा उधर जाएगा जबकि women's जो they are more capable to describe their feeling there was one study कि जिस घर में बहनें बेटियां नहीं है जब माँ मर गई लड़कों को पता नहीं क्या कैसे इजहार करें रोए कैसे they were not able to describe express their feelings कि माँ मर गई मुझे क्या करना चाहिए. Now this is the WHO slide that 350 million people are worldwide suffering from depression and around 1 million people kill themselves by suicide and this is underreported. एक जहाज गिरा 152 लोग वहां पे मरे उसमें उस पर तवज्जो हो गई ये 10 लाख every 40 seconds one person kill himself and we can prevent that. How we can prevent? हमारे यहाँ जो बाथरूम में चूहे मार कीड़े मार दवाई एक्सीडेंटली भी ले सकते हैं एंड दे क्या जब किसी को सुसाइड का ख्याल आ ले लिए भैया उस 200 रुपए खर्च करके लॉक कर दो. तो therefore हमें चाहिए what we need to address this and how can uh, improve mental health and mental health improvement can lead to good health, social impact, economy is directly related to our mind because if you are good for yourself, your family, organization कि आप अपने लिए जो चीज पसंद करते हैं दूसरे के लिए भी पसंद करें तो टीचर अपना काम सही करे और डॉक्टर अपना काम सही करे तो सब चीजें ठीक हो जाएंगी तो दिस कैन लीड टू अ लॉट ऑफ economic growth. Now, this is the key shift from transforming mental health for all. For example, before there was a problem that limited value and intention to mental health was there, widespread stigma. People are shy to say that I am feeling depressed. They don't shy कि मुझे उल्टी दस्त हो रही तो वो स्टिग्मा है एंड उसको कैसे ठीक कर सकते हैं ठीक इस तरह से मेंटल हेल्थ इज ए वैल्यू फॉर ऑल एंड नोबडी इज इम्यून टू डिप्रेशन एंजाइटी आई कैन हैव यू कैन हैव आप मुझे बताएंगे हाउ मच ऑफ यू हैज रिमेन्ड कभी उदास रहे जो नहीं रहे वो जरा हाथ खड़ा करें तो कोई भी हाँ, वो तो दुनिया में या तो वो जिंदा नहीं है या वो कह रहा है तो झूठ बोल रहा है बिकॉज लाइफ स्टार्ट विथ क्राई जब बच्चा दुनिया में आता है रोता नहीं रोता है तो वो हॉरेबल जो हमारी गायनोकोलॉजिस्ट जोर से थप्पड़ मारती है कि रो पड़ो इधर क्राई फॉर हेल्प सो देयरफॉर इसमें इक्वल पार्टिसिपेशन इन सोसाइटी फ्री फ्रॉम डिस्क्रिमिनेशन ठीक है तो इस तरह से जो है सर्विसेज अंडर यूटिलाइज उसको भी ठीक कर सकते हैं मैं जरा जल्दी थोड़ा जाऊंगा लेकिन ये प्रॉब्लम और ये किस तरह से मसला कर रही है एंड हाउ टू इम्प्रूव दैट दीज आर द सॉल्यूशन नाउ unfortunately if you look at global mental health 1% is spent on human resources बिल्डिंग खड़ी होती है इंसानों पर खर्चे नहीं 1% of the budget is spent जिसमें 43% nurses पे others पे and unfortunately पाकिस्तान में for 25 million people हैं तकरीबन उसके लिए 650 psychiatrists we need 9,000 psychiatrists and we are 650 psychiatrists. Therefore, we need to invest on human being. Or and you know, in just in UK and America, there are more than 3,000 Pakistani psychiatrists working. If they are given equal opportunity in Pakistan, they will come. And look at the mental health data availability. That mental health data availability from Pakistan, no mental health data has been compiled. Because when हमने जब उनको लिखा HCC को तो उसने वादा किया 2 करोड़ में पूरे सर्वे के लिए, बाद में हम 20 लाख से ज्यादा नहीं देंगे। तो फिर हमने अपने तौर पर वो भी दिखाते हैं कि हमने कैसे किया। एंड बाकी मुल्कों के भी यही हाल है, ये सब लोगों के जाता ही नहीं है इसमें से, पता ही नहीं है सुसाइड रेट क्या है, कॉमननेस क्या है। And we cannot achieve the WHO sustainable goal unless focusing on mental health. You know, when they focus on non-communicable disease, they ignore psychiatry, the mental health. Then we have advocacy for that, and now it has been included in the non-communicable disease. So if you look at for the first goal of sustainable goal development is no poverty, zero hunger, each and everything. For example, how we can have equality in जिस तरह रोटी कपड़ा और मकान जहाँ से निकाला था ना, वो कहाँ से था? That was Maslow के मॉडल से. This is the basic requirement of human being. तो अगर जो है डिफेंस वाले लोग, डिफेंस वाले में नहीं कहें, जो अमीर लोग हैं वो कम खाएं या खा के फिर कैलोरीज जाया करते हैं, तो वो कम खाओ, दूसरों के लिए छोड़ो. इफ ग्लोबली यू लुक एट दी आई वाज टॉकिंग टू माय फ्रेंड मुस्तफा के दे डिस्ट्रॉय जो गंदम और दूध समंदर में फेंकते हैं कि लोगों को नहीं देना कि रेट कम ना हो जाए. अगर इंटरनेशनली अमीर लोग बजाय ये कि कैलोरी जाया करें, पेट्रोल ज्यादा डाल के, फिर वाई दिस शुड बी, खाने के लिए जीना है, जीने के लिए खाना है, खाने के लिए नहीं जीना है. जिस तरह खाने पे टूट पड़ते हैं, फ्री का खाना जब दावतों में होता है ऐसे टूट पड़ते हैं उस पर. तो देयरफॉर अगर इसको, इफ वी वांट दैट गुर्बत खत्म हो, इक्वल डिस्ट्रीब्यूशन हो खाने की, हर चीज की, तो बड़े मसले हल कम हो. Now, poverty is directly related to mental disorder. If we, there was a study carried out that schizophrenic patients are basically more prevalent in slum area. The other researcher, he has done PhD, right? The other person who did the PhD, this is wrong. Actually, down drift का concept दिया कि schizophrenic are not able to reside in posh area, they have to be trained to that area. So instead of saying that schizophrenia is the illness of poverty, no, it lead to poverty. Now, how we can prevent these illnesses? We can genetically, Professor Radha Shahid, and we are doing some research on that with and Mustafa with the Saudis. If you look at this slide, that from conception, marriages are done on the basis of high status rather than good compatibility. अगर उसी से जो है हम देखें कि थैलेसीमिया we can prevent a lot of, there are 3,500 autosomal recessive disease that can be prevented with genetic counseling and avoiding cousin to cousin marriages in that case. 3,500 illnesses. And if we, for example, at this age, we can bullying, अगर हम bullying रोकें in classes, कि ये थोड़ा बाल कम है तो गंजा, लंबा लंबू है, काला है, किसी गोरे को किसी काले पे कोई फोकियत नहीं, माँ सवाए तक पर. और वो हम लोग जो है उसको बुलिंग करते हैं, फिर लैंग्वेज पे करते हैं बेचारे के साथ. हाउ वी कैन चेंज हिज कास्ट? वी कैन नॉट चेंज हिज कास्ट. वो कहते हैं ये वो है, ये फलाना है. So therefore, these bullying at societal level can prevent a lot of fear, phobias, and depression. Now, how we can start? How we can start improving the global scenario? Starting from yourself. Instead कि दूसरा ठीक हो, खुद को ठीक करो पहले. खुद को ठीक कैसे करें कि आप जो है अपना वक्त पे सोएं, वक्त पे उठें, वो हम बताते हैं. Then family, then community, then society. Now, ये मैंने बनाया. This is very important slide. I need your focus. If you ask me that how I can improve my mental well-being and prevent not only mental disorder but also physical disorder like diabetes, hypertension. Individually, what should I do? I improve my ABC, affect behavior, cognition. Then half हाइजीन पे, पाकी पे, निस ईमान, वो भंगियों के लिए छोड़ा। उसके बाद में आता है हुकूक लिबाद। हुकूक लिबाद 25-30% वो अंग्रेजों के लिए छोड़ा है। अंग्रेज का है, वो नौकरी से निकालेगा, यू आर वेरी कैपेबल पर्सन बट अनफॉर्चुनेटली आवर ऑर्गेनाइजेशन कैन नॉट टेक फुल एडवांटेज ऑफ योर कैपेबिलिटी, देयरफॉर इट इज रिग्रेटेड। वो आपको नौकरी से निकाल रहा है, समझ रहे हो कि ये तारीफ कर रहा है। तो ये हुकूक लिबाद है कि आप शाइस्तगी से बात करें। एंड देन वर्क इज वर्शिप। तो वर्क इज काम करना, ये चाइनीज जापानीज के लिए छोड़ा हमने। तो क्या होता है, तो 90% पेपर अटेम्प्ट ही नहीं किया, वो कहते हैं मैं पास हो जाऊंगा। कैसे पास होंगे? अच्छा, फिर क्या है? हेल्दी लाइफस्टाइल, good sleep, balance between your sleep, pray, exercise, balanced diet, leisure activity, and time management, and responsible physical and reproductive activity. That is sexual health. And then avoiding tobacco and other substance. And this is very important, rational utilization of mobile, computer, and other electronic gadgets, and regular checkup. And then what should collectively done? Collectively, Japan was on number 12 position at society level, and they asked me to visit their facilities. I was sponsored by the WHO, and they have just worked on this component कि बाहमी ताल्लुकात और रवैयों को ठीक करो। सीनियर, जूनियर, मदर इन लॉ एंड डॉटर इन लॉ, colleagues, आप बाहमी ताल्लुकात और रवैयों को ठीक करें तो मसला ही हल हो जाएगा। सो देयरफॉर ये जो है, दैट इज इम्पोर्टेंट। अब नाउ आप हाउ टू इम्प्रूव योर ABC, हाउ टू इम्प्रूव योर कॉग्निशन, कि you should think globally and also look at your colleagues, your family, your friends, everything, how to improve that। और उसके लिए ये है, सबसे पहले कहते मैं नहीं कर सकता, मैं नहीं तकरीर नहीं कर सकता, आप करेंगे तो होगा। तो देयर इज ए चाइनीज वर्जन, इफ वन कैन डू इट यू कैन डू इट, इफ सम कैन डू इट यू कैन डू इट बेटर, इफ नन कैन डू इट यू मस्ट डू इट। और हमारे यहाँ क्या है, इफ वन कैन डू इट लेट हिम डू इट, इफ सम कैन डू इट नो नीड टू डू इट, इफ नन कैन डू इट हाउ कैन आई डू इट। इसको ठीक करना होगा कि हम कर सकते हैं। जब वे इफ हम एटॉमिक एनर्जी की पावर हमने भी जिस तरह से जो है जंग इंडिया से की है, वी कैन डू ए लॉट ऑफ गुड थिंग्स। प्लीज कंसिडर योरसेल्फ कि अल्लाह ने आपको बेहतरीन मखलूक बनाया है, एंड यू हैव टू यूटिलाइज। ये खत्म होना चाहिए मैं पाकिस्तानी प्रोडक्ट ये नहीं है वो नहीं है। पाकिस्तानी आर वेरी कैपेबल। आई हैव बीन टू 71 कंट्रीज। पाकिस्तान की मौसम, लोग, दे आर वेरी कैपेबल। जमीनें इतनी अच्छी हैं हमारी। तो इसको ठीक करना होगा। फिर ये जस्ट प्रायोरिटाइज थिंग्स। प्रायोरिटी क्या है अभी हमारे यहाँ स्टूडेंट्स की? बस पढ़ो लिखो, मुल्क से बाहर जाओ। अरे भाई, सबसे पहले ईमान है, फैथ, देन हेल्थ, देन ऑनर, देन हैप्पीनेस, देन क्रेडेंशियल डिग्रियां, देन ये वेल्थ, ये डिग्रियां जो हमारे पॉलिटिशियन ने सारे रखे हुए। खाएंगे कब? उस वक्त दांत होंगे नहीं, गोश्त पड़ा होगा। So therefore, Singapore has changed the education system. They say that high marks is not criteria of success. Myself, look, I was an average student in the medical college, and none of my students reached to grade 22. I reached to grade 22. हम दरमियाना पढ़ते थे, सारे मरीजों लोगों की खिदमत करते थे। तो यह सिंगापुर has changed this, high marks should not be the target of student. How to remain happy, ये खुश रहना, कनात पसंद रहना सीखे। ये कहते हैं is ज्यादा marks is not criteria, and EQ is more important than IQ। and now how to manage self, जो हम बात कर रहे थे, personal growth, professional growth, maintain good relationship, increase wealth and good health and integrity, dignity, all these are important for us। And spiritual health, अब ये है कि हमारे नौजवान आजकल दे आर टेक्नो स्पीशीज, लगे रहते हैं, दे आर नॉट यूजिंग देयर ब्रेन एंड जस्ट पैसिवली लुकिंग थिंग्स। सो देयरफॉर ये वक्त आएगा कि बच्चा पैदा होगा, गर्दन टेढ़ी होगी, मोबाइल सुनता हुआ आएगा। अच्छा, एंड देन मेरी अगर मर्जी चलती कि हर क्लास से पहले 10 मिनट दौड़ाता, because exercise lead to a lot of good thing, increase productivity, reduce anxiety, stress, and boost confidence. Now, how can we prevent psychiatric disorder at uh, our local level and global level? Yes, if we combine efforts of patients, families, employer, society, school, college, healthcare system, and media, collectively we can prevent, treat, and defeat mental illness. Now, the horizon of mental illness, if we want really that we should improve our well-being, starting from individual to groups and then global level, we have to focus on all the things. For example, we have to focus on the genetic lifestyle. If we improve, for example, improve lifestyle, we can prevent a lot of diabetes, hypertension. We can prevent genetic illness like, for example, leukemia and other things. And similarly, if we so therefore we have to collectively now new things epigenetic. If your gene is not good, you can even improve that. Epigenetics is a new thing. And these are the things that we have talked about, that there should be mental health, good policy, legislation, and activation of the authorities. In Pakistan, there are 5 authorities of mental health, and only one is active. The rest has not even done a single meeting. And then a mental health foundation, and then mental health survey. What we have done, I'll show you. Promoting positive mental health and preventive psychiatry. Similarly, early screening should be done. A patient बिल्कुल बांध के लाते हैं तब वो आता है. Increase training positions, subspecialty like forensic science. We in Pakistan are needing a lot of child psychiatrists. There are only four psychiatrists. When I was dean of the College of Physician Surgeon, I recognized 3 centers. And I personally, in COVID, I went to Lahore to recognize the facility there in King Edward Medical College. And one of the Secretary General of the college died due to COVID. That, and we have to have mobile units and similarly other good options. Now, how to invest in wealth? This is important. This main topic was when I gave a talk in Sri Lanka, the American objected that we are spending a lot of money, but we are not achieving the good result. I said, because you are just considering investment money. It is beyond that. What is that? You have to put attention, intention, near to attention, attitude, time within. Time, if you give time to people, to patients, family, community, student, that will really improve the mental health. And energy, resource, and advocacy. The topmost psychiatrists worldwide, I met him and asked him, what you will give me advice? He's to advocacy, advocacy, advocacy. If we do advocacy for the mental health, we can achieve a lot of a good thing. And how we this, because most of students are here, everything should be mindful. Mindful से मुराद है कि paying attention to what you're doing at current level with attention, intention, and attitude. Considering your study as a blessing rather than burden. Considering your work as a worship and therapy. Work is worship, work is therapy. गाड़ी नहीं चलेगी, बैटरी डाउन हो जाएगी. तो इस पे मैंने कहा हाँ. So the Professor Razaur Rahman और हमने मिलके ये किया था कि कॉन्फ्रेंस कराई. कॉन्फ्रेंस जनाने करानी थी, उन्होंने लेटर लिखा था, हमने वही करा दे. तो उसमें जो पैसे बच गए उस पे ये स्टडी हुई है, अभी ये इंटरनेट पे पड़ी है, जो छपी नहीं है. $6,000 मांग रहे हैं छपने के. तो उसके हिसाब से प्रोफेसर रजा को ये क्रेडिट जाता है और हारून साहब को, इसके हिसाब से 37.9, दैट मीन 38% ऑफ द पर्सन had some mental illness during their life, and 32%, that is almost one third, is having currently any mental illness. और इसमें जो है स्ट्रेस रिलेटेड, इसमें सबसे ज्यादा डिप्रेशन वाज द मोस्ट कॉमन, around 20%, then neurotic disorder 24%. These are common illness, and unfortunately 6% of the patients said that they had some suicidal idea during the past month, and 1% acknowledged suicide attempt. That attempted, this is very huge thing. हमारे यहाँ कहते हैं कि नहीं है, और इसके लिए हमने क्या किया, अब व्हाट वी हैव डन, एक तो हेल्थ रैप के थ्रू जो है, हेल्थ रिसर्च एडवाइजरी बोर्ड, आई एम द वाइस चेयरमैन ऑफ दिस, उसके थ्रू हमने साइकेट्री की रजिस्ट्री स्टार्ट कर दी, और बाकियों की भी हो रही है, और उसमें हमने ये साइकेट्री की रजिस्ट्री हमने सखर में गोल्डन जुबली के मौके पे इसको स्टार्ट कराया। दूसरा हमने क्या, व्हेन आई रिटायर्ड फ्रॉम जनाब पोस्ट ग्रेजुएट मेडिकल सेंटर, वी स्टार्टेड स्टूडेंट हेल्थ एंड वेलबींग पाकिस्तान, एंड कनाडा में है वो शहर, तो उसमें यही था कि द स्टूडेंट शुड consider study as a blessing rather than burden, and people should consider work as a worship and a therapy. गाड़ी नहीं चलेगी, बैटरी डाउन हो गई। दूसरा हमने ये जनरल पाकिस्तान साइकेट्री सोसाइटी जो हमने अभी रजा शाह साहब को पेश की, ये हमने फ्री कर दी, बिकॉज व्हेन आई वाज गिवन द रिस्पांसिबिलिटी एज ए चीफ एडिटर, तो हमने देखा कि देयर आर टू प्रॉब्लम वी फेस। नंबर वन, कि इसके पैसे होते हैं, हमने फ्री कर दिया, क्योंकि अभी 6,000 बाहर अगर आप इम्पैक्ट फैक्ट में छपवाते हैं तो $2,000 से तो ऊपर ही लेते हैं। एंड देन सेकंड थिंग वाज कि सीनियर लोगों का आप भाई अपना अकाउंट बनाओ, अपलोड करो, दे वर नॉट डूइंग दिस। सो हमने सोचा, अभी हमने प्लान किया है, नेक्स्ट प्लान है कि वी ट्राई टू ट्रेन द सीनियर्स, they are not capable to handle the new things. So therefore हमने इसमें ये किया, डॉक्टर आमना और डॉक्टर साइम हमें साथ थे, कि उनके अकाउंट बना के फिर वो कहते ये भेज रहा हूँ, बस छपवा दे। ऐसे कैसे छपेगा, वो तो ओजीए सिस्टम में, ओपन जनरल सिस्टम में नजर आना चाहिए एचईसी को। तब जो है एचईसी ने हमें रिकॉग्नाइज किया। नाउ वी आर लकीली रिकॉग्नाइज्ड बाय एचईसी, पीएमडीसी, कॉलेज फिजिशियन एंड डब्ल्यूएचओ एमरो। तो हमने फिर यही प्लान किया है कि अब हम रिसर्च असिस्टेंट ट्रेन करेंगे, और हर फिजिशियन को कहेंगे इसको रख लो 20-30 हजार रुपए में, ये आपके सारे काम करेगा। ये हमने नेक्स्ट प्लानिंग है। अच्छा, दूसरा क्या किया कि डिप्रेशन के लिए रजा शाह साहब के साथ मिलके हमने केटामीन की ओरल पार्टिकल, अमेरिकन हमें नहीं दे रहे थे, वो इस केटामीन का तो हमने अपनी बनाई इसके लिए, और इट्स वंडरफुल थिंग। एंड though the ethical committee did not allow us to apply on human being, तो एनिमल स्टडी कंप्लीट हो गई इस पे। तो ये हमने अभी तुर्की में मैंने प्रेजेंट किए पिछले महीने इंटरनेशनल साइकेट्री फोरम में। अच्छा, with this I'll end my talk. Uh, with this I'll end my talk. I want to show that let's join hand to promote mental health, prevent, treat and defeat mental illness by all levels and by all means. और यहाँ आप देखें कि दिल और दिमाग को बैलेंस में रखें, और फ्रॉम इन्फेंसी बल्कि कंसेप्शन टू ओल्ड एज हमने हर एक का ख्याल रखना है। ये पता नहीं, मेरे ख्याल में सही होता हूँ ये। तो इस तरीके से आपने अपना ख्याल भी रखना है, और साथ साथ जो है लोगों के साथ भी चलना है, तो कंट्रीब्यूट करना है। मैं आपके लिए काम करूँ, आप मेरे दूसरे के लिए करें, तो इस तरह से सिस्टम बन जाएगा। विद दिस आई एंड माय टॉक। थैंक यू वेरी मच फॉर योर अटेंशन। थैंक यू। इफ टाइम है क्वेश्चन, हम टाइम से पीछे तो नहीं है, देखो। अच्छा, इफ यू हैव एनी क्वेश्चन आई विल बी ग्लैड टू आंसर। प्लीज इंट्रोड्यूस योरसेल्फ।
the Department of Biochemistry and Federal Faculty, and I'm also the director audit at my university.
Oh, wonderful.
So I am very much into mental health and well-being. और मैं एक चीज पूछना चाहूंगी, आपका ये जो जर्नल आपने बताया, मैं कुछ रिसर्चेस मैं बायोकेमिस्ट, लेकिन मेंटल हेल्थ जिस तरह फिजियोलॉजी और बायोकेमिस्ट्री दबा रही है
जिसको अपन को दिलोगे।
अच्छा जी,
मेंटल हेल्थ जिस तरह से फिजियोलॉजी और बायोकेमिस्ट्री होती है वो बहुत अफेक्ट करती है, तो इस पे कुछ रिसर्चेस हम भी कोशिश करते हैं, क्या हम लोग भी इस जर्नल में अप्लाई कर सकते हैं?
एनीथिंग रिलेटेड टू मेंटल हेल्थ, चाहे मिसाल के तौर पर ये कि आप ये कहेंगे कि हमारे कितने % लोग जो हाइपोथायराइडिज्म है उनको क्लिनिकल डिप्रेशन, ये लोग हैं। बायोकेमिस्ट्री जो मैंने साइमा का नाम लिया है, तनी वो आबिद साहब की नहीं बल्कि उसकी शागिर्द है समीना बानो की, शी वाज आल्सो वर्किंग, उसका नाम भी है इसमें, वो बायोकेमिस्ट्री की हैं। तो हाँ, तो ये है कि एनीथिंग रिलेटेड टू मेंटल हेल्थ, एंड नो यू कैन नॉट सेपरेट द मेंटल हेल्थ फ्रॉम फिजिकल, बायोकेमिकल, सोशल हेल्थ। बायोकेमिस्ट्री ही तो है, आप किसी का सेरोटोनिन का लेवल कम करें, उदास हो जाएगा, डोपामिन का लेवल बढ़ा दें, शक शुबे करें। और ये जो जर्नल है ये आप jpps.pk, ये फ्री है, हर चीज डाउनलोड, एवरीथिंग हमने फ्री रखी है। मैंने कहा दिस इज कंट्रीब्यूशन टू द कंट्री। जी, एनी अदर जी प्लीज।
लेकिन मेंटल हेल्थ डिपेंड कर रहा होता है आप एनवायरनमेंट में काम कर रहे हैं, आपका ऑफिस का एनवायरनमेंट कैसा है, आप जिस अपार्टमेंट में रह रहे हैं या ड्राइव कर रहे हैं तो ट्रैफिक कैसा है, इससे भी आपकी जो मेंटल वेलबींग है डिपेंड करेगी। मेरा सवाल ये है कि ऐसी सोसाइटी में जहाँ पर आप रह रहे हैं तो उसमें आप अपने आप की मेंटल वेलबींग किस तरह से केयर करेंगे, तो दूसरे जो है वो सेल्फ सेंटर।
बड़ा अच्छा सवाल है। इसमें ये है कि एक तो ये फर्स्ट ऑफ ऑल यू कंसिडर कि दुनिया है, जन्नत नहीं है। या नबी जो है 100% रिजल्ट नहीं ला सके, मैं और आप क्या है, नबियों की जुबान में लुकनती जिस्म में कीड़े, नाहमवार हालात में साबित कदमी से चलना कमाल है, उसके ज्यादा नंबर मिलेंगे। अगर आपको कोई सामने वाला आपका कोलीग तंग कर रहा है और आपको छेड़ रहा है, आपको बुलिंग कर रहा है, आप कहें और करो, आपके दर्जात तो बढ़ रहे हैं ना। अगर आपका विजन वो, तो ये ज़हन में रखें कि जब लोग गलत हरकतें कर रहे हों तब आपने अच्छा काम किया तो उसका ज्यादा अजर मिलेगा। और दूसरी बात है जो मैंने कहा कि एवरी इंडिविजुअल शुड इम्प्रूव हिमसेल्फ रादर देन इम्प्रूविंग अदर्स। तो अगर जो है दुकानदार अपना काम करे, टीचर अपना करे, डॉक्टर अपना करे, इकोनॉमिस्ट सही करे, तो मसला कहाँ हो। हर एक को अपने आप को ठीक करना है। अगर ये नहीं कि मैंने ठेका उठाया कि सब चीजें ठीक करूं, ठीक कोशिश करूं, लेकिन इन्नल्लाह मा साबिरीन। दूसरा उसको कंसिडर करे कि ये बादे मुखालिफ आपको ऊंचा भी ले जा सकते। बादे मुखालिफ से ना घबराना, इकाब ये तो चलती है तुझे और ऊंचा बढ़ा। दूसरा, हम रास्ते में सोच रहे थे कि खुद ही को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से पूछे कि बता तेरी रजा क्या है। So you have to, in English, you have to acquire that high quality जो level है, so that तकदीर और अल्लाह God ask you कि what is your wish, we can go there। तो आप अपने आप को इतना बुलंद करें कि वो हर तकदीर आप खुद बना सकें। ठीक है।
आपने एडवोकेसी के बारे में बात, मेरा क्वेश्चन ये है कि सेल्फ एडवोकेसी एडल्टिंग के अंदर हम किस तरह प्रमोट कर सकते हैं, खासतौर पर जिस बात हमारे सराउंडिंग में है मौजूद मेंटल हेल्थ के लिए, तो हम टीनेजर्स को या एडल्ट्स को किस तरह से एम्पावर करेंगे वो अपने बारे में जो उनको प्रॉब्लम लगा रहा है उसको जान सके, क्या आगे बढ़ना और बेटर हेल्थ को सीख सकें।
ये बड़ा अच्छा सवाल है। उसमें सबसे पहले ये कि आप पहल करें बताने में, और जिसको प्रॉब्लम है उसको तंग न करें, उसकी हेल्प करें। जब वो हेल्प करेंगे तो खुद ही कहेंगे अच्छा, ये पहले कहते थे कमजोर दिल वाला वाज नॉट कंसिडर्ड गुड थिंग। बुज़दिल, बुज़ किसको कहते हैं? बकरी को। दिल, बुज़दिल का मतलब डरने वाला नहीं। अब जो है कार्डियोलॉजिस्ट ने अपनी फील्ड को इतना उजागर किया, और वो कहता है मैं दिल का मरीज हूँ, ख्याल रखना। मैं जो है, मुझे ब्लड प्रेशर है, मुझे एंजियोप्लास्टी हुई है, मैं साउथ सिटी में एंजियोग्राफी करा चुका हूँ। तो उन्होंने अपनी फील्ड को बड़ा उजागर किया। कान काला अभी भी कोई नहीं लगा था। ऐनक जब मुझे पहले की थी, मेरे बुआ सकते थे क्या हो गया, इतना क्यों पढ़ते हो, लोग सोच नहीं सकते थे कि ऐनक लगाना भी लड़कियों में बुराई समझा जाता। और नफ्सियात की बीमारी तो और भी पीछे है। उसकी वजह ये है कि जितना काम होना चाहिए वो नहीं हुआ, और दूसरा ये मीडिया ने गलत साइकोलॉजिस्ट, साइकेट्रिस्ट और मेंटल पेशेंट पे और नफ्सियात पे ऐसा उल्टे सीधी लतीफे बनाए हैं, तो जिसकी वजह से जो है, हालांकि नफ्सियात विल टेल यू हाउ टू स्टडी, देयर इज अ साइंटिफिक मेथड विच आई अप्लाइड ऑन मी। तो सब हंस रहे थे आप कैसे पास होंगे, मैंने कहा आप लोगों से पहले पास हो गए, और मैं पहले ही पास हुआ। तो लिहाजा उसके लिए ये है कि जो नौजवान हैं वो दूसरों का ख्याल रखें कि अगर कोई अ, अच्छा इजहार नहीं करते ना, हमारे कहते दुनिया में सबसे ज्यादा झूठ क्या बोला जाता है, फाइन। और पाकिस्तान में से झूठ, भाई मुंह क्यों सूजा है, कुछ नहीं, भाई क्यों, कुछ नहीं, बता एक्सप्रेस नहीं करते हैं। तो अगर लोग एक्सप्रेस करें जैसे आपने कहा, और फिर दूसरे को जो प्रॉब्लम है बजाय उसको छेड़ने के, यार पागल हो गया, पागल क्यों हो गया, 91 95% साइकेट्री इज नॉन पागलनेस। तो इस लिहाज से जो है, और कायदे कवानीन हो, लोग एक्सप्रेस करें। मीडिया में अगर बड़े बड़े सेलिब्रिटी कहें कि मुझे भी बीमारी थी, अब आप देखें ना कि लेडी डियाना 2 साइकेट्रिस्ट को दिखाती, इस तरह से बुश भी दिखाते थे। मैं पाकिस्तान के नाम नहीं लेना चाहता कि बड़े बड़े लोगों को हमने ईसीटी दी है, जजेस को ईसीटी दी है हमने, ठीक। आई थिंक अगला स्पीकर and I'm really thankful to Dr. Irfan that who is spared time, and thank you very much.
Thank you, sir, for such an amazing lecture. And I would like to request Dr. Syed Irfan Ali to deliver his lecture on youth mental health challenges in recognition and intervention.
ये वाला है। अस्सलाम वालेकुम। पहले तो बहुत शुक्रिया for this opportunity to speak to you all and share my thoughts. Just one small correction. I've been attached to teaching and training for many years. I've been a lecturer, but I'm not a professor. So just for the record, we don't misrepresent. So look, that was a lovely presentation, Dr. Iqbal. So you have covered most of what I wanted to say, okay? So I don't know what else I can add, but maybe a few things that might indirectly answer some of the questions you might have. And I suppose not to paint a stark picture, a dark picture when I share with you my initial slides, but nonetheless, we have to face the reality where we stand, and then see. I probably understand a little bit of a stigma um, because it is around, and your question is actually, when you talk about it, advocacy and how they can advocate themselves, really there are other factors. So it's quite intricate, you know, it's not as simple. And your question earlier on, yeah, that people are mean and how you can swim out of that, you know, sea of I suppose annoyance and headaches, and how you can get to the other side, you know, and still feel okay. So I mean, I have a few slides, so I'm going to keep it short. Some of it is covered by you. I'm just going to pick on a few more things there. So basically, it's about youth mental health and increased global burden of mental health disorder. But I probably dip here and there as I talk about different things. So the thing is that global burden of mental health is mounting, right? जो पहले mental 2019 से around, they're still going on since post-COVID. So it's not decreasing. And it is serious and it's alarming. So one needs to recognize that problem is growing and where we are. So the first couple of slides will be about that. So over past 30 years, there had been huge increase in the number of young people suffering from anxiety disorders, major depressive disorder, conduct disorder, and with alarmingly high rates in eating disorder. So 24%, 24.3 in bulimia nervosa and 17% anorexia nervosa. It is on the rise, you know, and atypical eating disorders are there. And what I want you to kind of get from here is that not everything is captured. People, when the problem gets out of hand, that's when they go to somebody. But what happens before that? Problems are still there. They are not captured. So what I want you to draw your attention to that fact, there are a lot of people who are suffering, but they have not been captured. There's no way to capture them, and they are not sick enough to go to the doctors. Or they ponder on their own, am I sick, am I not sick? And there's a lovely Canadian qualitative study for youth, university goings and college going youngsters who actually contemplate. And then self-stigma. And what is self-stigma? So some of those slides will cover down the line, but I'm just kind of set the scene for you that what we are actually talking about. It's about what is self-stigma and how our experiences lead to seeking help. What we need to focus on is it's vital for good mental health that we identify people earlier on in their journey. Otherwise, we have a big problem. And that early identification requires good system, self-appraisal of a good mental health, and those are the prerequisites. But with a slight twist that in children, they don't recognize it. So it's somebody else have to recognize it for them, whether it's school, parent, teachers, and all the rest. So the problem is big. So these slides are just kind of bringing to your attention. These are things you already know. I'm not sharing anything particularly new, but just to sort of signpost it, if you will. So globally, 8.8% of children and adolescents have been diagnosed. So this is just the diagnosis with variety of mental health. And this is Global Burden of Disease Study 2010. So just a small reference for you. 20% of the children suffer from disabling mental illnesses. Suicide is the third leading cause of death among adolescents. Dr. Iqbal touched it, but it is alarming. It's the third leading cause, preventable. Maybe not in all cases, but to some degree, what we could do to prevent it, and that's what we need to examine in our own lives as professionals, as neighbors, and in whatever capacity we operate, friends, you know. Gaps in resources can be categorized, and that's from that same study. And this covers everything: economic gap, manpower, training, services. That's Journal of Clinical Psychiatry and Psychology. So they referred in that journal, the Atlas project, which was by the WHO, is that there is the key findings included lack of program development in low-income countries. Pakistan is one of them. So lack of program development. Now that's complete lack of program development. That's what I'm talking about. Then lack of any policies in low-income countries. Absolute lack of any policies. Absence of specific comprehensive policies in both low and high income countries, and definitely no specific policies that we have here. Lack of continuum of care. We don't have it here. And there are universal barriers to access. There are a number of, you can break it down into other categories, but so there's lack of everything. So in a climate like that, when you have lack of everything, then you have to start working everywhere. And that's where this whole task of mental health awareness, treatment, identification becomes humongous, because you have to start working in almost every area to get it to a level where you can talk about it. talk about treating. And that's why it's an essential element, early identification. Just to make a point here, behavioral anxiety disorder commonly present in childhood. However, most of the highly prevalent conditions such as mood, anxiety, substance abuse, as well as psychotic illness emerge during adolescence and early adulthood. That's very important. Early age of onset has been shown to be associated with longer duration of untreated illness, poor clinical outcome, poor functional outcome. So majority of the illnesses that you actually see have their onset in childhood. So you really have to pick this early if you want to treat it. But how can you? With tons of barriers that I'm going to talk about now, just I'm going to go through the headings, but with those barriers and keeping in mind there's lack of everything, where do you start? And that is a, what do you say, monumentous task, you know. Okay, so what are the barriers to accessing support? So lack of awareness, lack of knowledge. So if it's a young person, so who will advocate for them? That's the point. Those who look after them. So first person, obviously the parents. Do they know enough about mental health to appreciate an illness which has not become civic? So the problem is that somebody is absolute crazy. You can spot that person, whether it's a child or an adult. For that parent to recognize a problem in a young person, let's say up to the age of 22, 23, 24, and then reach out for help, considering they don't have any knowledge themselves. So you have a higher chance of that problem staying there and becoming chronic, because the parent doesn't know, they are clueless. But what about teachers? They are clueless too. At least in this country, majority of them don't have a training. Even the UK, there was a Scottish study I was saying, the teachers wanted to help, but 70% in one of the surveyed Scottish schools, they said 70% of them, we don't have no training, we don't know how to help them. Now, these are we talking about the developed countries, and 70% from that, we don't know how to help them. And in reality, as I worked there, and I worked both in North America and Europe, a lot of people don't know. With all those service design structures in place, they have a problem. So what chances do we have here? And that's painting a stark picture, but that's the reality. Very bad scenario. And then belief system. That's a bigger problem with the cultural psychiatry. So for example, I know many Pakistanis and many back in there, and particularly people from Middle Eastern, Sudanese and other backgrounds, Bangladeshi, Indian, Pakistanis, they don't believe in that. A lot of them. And if they do, they probably drop in. Moms will be more supportive. Child has no clue. So your work starts in convincing them, changing their belief system and subscribing to mental health. In here, people don't. I know a lot of people I see when I come here, a lot of families contact me and I see they haven't even begun their journey with the mental health because the mom may be suspecting that the child may have a problem, but they'll say, well, it's in mom's head. It's mom's problem. It's in her head. So the belief system is very important. And that again is connected to your education and what sort of thing. And they will go to Hakim, they will go to spiritual leaders, they will go to all of them just to avoid a psychiatric diagnosis. I'm going to come to a very delicate point in a psychiatric diagnosis. I think you should pay attention to that when I come to that. But we don't need to worry about psychiatric diagnosis. All we need to think about, is there a problem? Because when you make psychiatric diagnosis, you have DSM and ICD and the doctors who go and say, well, I look into this diagnosis, you have these symptoms, you don't have these symptoms. This is very simplistic. Korean study, I was reading one of that suggested we should have stages, because we can't even comment who has a mental health problem. There are problems, and there was an American study, I don't know whether it was Wisconsin or some other state, that said a lot of people don't know the developmental psychology, the trajectories of mental health problems, and it's hard for them to recognize a mental health problem. So if you don't recognize this, even with very good resources and billions of dollars spent on it, people are struggling to recognize. That's why it is a complicated issue. And stigma, what we understand is stigma ke bhai pagal hai, crazy hai, ye nahi batana, and we worry about the consequences. A ladki hai to chupa ke dikhayenge. They don't want anybody else to know that their daughter has a problem because she will have a marriage issues, and they don't want to let it. Even epilepsy, forgets a guy. People hide epilepsy here, you know, and then employment issues, you know, you don't want it to be, and particularly invest, you know, you have a record. You have a record to go to mental health services. And if it's ever investigated, then you're going to go through 3 more interviews, or you may be questioned again. That, well, look, this person had been to a shrink. There must be something here, or is he a cuckoo? Do you get me? So it is very important to understand that the stigma is very much alive here and even in the West. And then, of course, access to the services is a problem. And then the cost is a problem. Even if you at some point decide, I have to go and see a doctor, then it will cost you money. So there are a lot of things that will stop you from seeking help. And that's for grown-ups. And I'm not particularly referring to child. It's just in general, these are the barriers. Then negative past experience. I've seen many patients here when I come here, and a lot of them don't want to go to a psychiatrist. I don't know. Some have come into my contact through 16 connections because they didn't want to go back to their doctor because he prescribed, and they don't know. The bad prescribing is very common, and it adds to the negative experience of the patient. That means it will stop them from seeking help again. And that's a bigger problem. And I suppose another thing to keep in mind, that somebody who is not seeking help, don't just assume it may be the nature of their illness. For example, people with autism, they don't think they have a problem. It's others who have a problem. People who may be slightly elated, and they like being a little elated, and they don't think there's a problem. People who have speech and language, communication problems, you know, people who have lack of insight for whatever reason, including mental health. So those people will not seek help. So you have a huge chunk of people who will just not go and seek help for mental health problems. And then poor self-recognition, lack of knowledge, prejudice, discrimination. 3 of them means stigma. So if you have lack of knowledge, self-prejudice, and discrimination, then you are discriminating yourself because you don't want to. And in order to come to realization that I need help, whoever you may be, and whatever is the nature of your problem, not necessarily a severe psychiatric problem. Let's say if you have a stress and you think I need help, there's a chance that you may talk yourself out of it and not seek help because you say, oh, you know, what will people think? I'm not sick enough. Ye to sabko hota hai. All those, I suppose, means of intellectualizing and talking to yourself because of the stigma, because you don't have knowledge, or because you're prejudiced against it, because of the societal, I suppose, reactions and repercussions of it, there is a stigma. And that is the first initial step that will encourage you to get help. Because if you don't come to that point that I need help, you're not going to seek help. But what will bring you to that point? So that's what I'm trying to bring your attention to. It's a product of all these things, amongst others. Then, even if you decide that I need help, where would you go? No services, you know, no pathways, no school counselors, no counselors in schools, primary school or university and college level. And we do not have a support network. There are no, I suppose, network groups that operate. We don't have good Samaritans. We don't have a phone number that we can dial and do that. So that discourages people from getting help. And there's no information out, at least from a reliable sources, where you can actually Google and read and inform yourself through a trustworthy source. That is lacking. And then the support structure within the own family system. Who will you get support from? Let's say if you talk, apni nan se, apni babi se, whoever, are they going to support you? Or are you going to say, well, you're being a lazy cow? She doesn't get out of the bed, she's suffering from depression, or for that reason, postnatal depression is very common. We don't have a system. I probably mentioned somewhere, for example, the next line is that public health nurse in the West, they will come. So she will recognize if there's a problem with mom, she's suffering with depression, postpartum psychosis, or with the child, newborn child, had circumcised birth, initial postpartum first 6 months, and what's the child's baby's growth is, and if you have a really good public health nurse, they can pick up a lot of neurodevelopmental pieces very early on, even in the 5-6 months of the birth of the baby. So you can see the lack of structure does impact what we were talking about in Dr. Iqbal, I think, and that's why maybe there's a lack of intelligence and we are not intelligent or we are not using intelligence. But I think in Pakistan, we have apathy. It's the apathy which is impacting people because people are disillusioned, disappointed. And the disappointment continues long. There is apathy. And that is also involved, and I think we should not ignore that the state of mind people have. Then, let's say you decide you get to the doctor. Would you run into a right clinician? What is their education and training? And that is very important. Majority of these diagnostic manuals that the psychiatrists use may not necessarily apply as in black and white, which happens unfortunately here. That people go and say, well, he has this diagnosis, he doesn't have anything. They are not, or they don't, or they lack the ability to see through all the, I suppose, mental health challenges that pre-exist before actual symptomology begins at a clinical level. And that's why it's very important to understand, as I mentioned earlier, there was a Korean study which was proposing there should be stages, just like in a cancer stages, that people should actually be able to say. And the other Canadian study I was mentioning, that if they ever go to a doctor, there is a problem that their clinician might say, you're not sick enough. आप यहाँ क्यों आई हैं बीबी? आप तो बिल्कुल ठीक हैं, बस खाएं पिए मौज करें, ये कर लें. So you trivialize the problem. That can discourage people from seeking help because you trivialize them. Or you biomedicalize it. You give 10 tablets. They may not be there. So a university study was that, and they were saying that a lot of people will just be put off by simply those experiences, that either their problem will be trivialized or they will come back with a lot of medication, and they didn't want either of them. And then diagnostic challenges, which means heterogeneity. Mental health problems can present in many different ways, and that's heterogeneity. And special subgroups like cultural groups or refugees, these are the population where a clinician might struggle, and the lack of adequate training, especially in relation to Pakistan, is gonna, is very relevant here. I think there are bigger challenges and struggles, and particularly in training education for psychiatrists. And of course, we do not have a mental health training in school curriculums. No sex education, no mental health education. You learn through apprenticeship model. You learn from your friend what's going on. That's how you find out. There's no education. And then limited evidence. Evidence-based research is still limited. So how you cultivate, how you help them to address that. So obviously the problem is at multiple levels. The solutions require, multi-pronged strategy, cultivating health-seeking behavior and combating stigma, mainly in youth. Better government policies, Dr. Iqbal touched all that, service design and structure, ensuring easy access, availability, and affordability. Those are important. And then efforts to reduce the stigma through all means, media and public education and all the rest of his school education, training education of the people who are involved with vulnerable groups, such as children, who can advocate for them, who can talk for them, and teaching mental health first aid. We talked about a lot of mental health first aid, Dr. Iqbal, in his previous presentation. That's important. And for clinicians not to become a pill pusher. Sadly, the reality of Pakistani psychiatry, you go to the doctor, you come back with few pills. majority of the problems in children are transient. Like, for example, I was working for, just give you a little span, 2 years in a child psychiatry service. I would have seen a few hundred patients. I probably referred 3 patients at the age of 18 to the adult psychiatry service. So what happened to the remainder of them? So the natural course is a lot of them get better. Not that we treat them very well all the time, but they do get better. So really initially finding out, detecting and giving them the right information, which does not require necessarily medication, just simple advice and counseling and support to parents. And we don't have social service and other that. And financial challenges, they contribute to that. If you provide that help, you can solve the problem. And thank you. Any questions? I'm okay. If you want any, or joint question to me and Dr. Iqbal.
Yes, you.
Can you speak up a bit? Sorry.
Like a good doctor, like I had some health conditions, some mental issues, and some neuro issues. I went to like 4 different doctors, but I was like coming back with different diagnoses and different type of pills, which was really disturbing. So how do you find the actual doctor, like good doctor?
Can anybody answer that? Because I don't have the answer. But you're right. It's not only here. I've seen that in Canada a lot. People come with pills, they prescribe, and maybe the health insurance and all the rest, that contributes too, because humans are humans, doctors are humans, they run after money too, and they make those mistakes. So you're right. I think you just, word of mouth is very important, right? Google them, know their credentials and training. And I suppose one is, the thing is heuristic. You go and see them. And when you know, I know it will cost some money, but look, you better waste a little bit in the beginning. I can tell you as a good doctor, I have that shoe, and I cannot tell you who is the best, but really good recognized institution where you know they're well trained, look at their credentials. And maybe if there's a website in US, there's a website and you can see all their feedback, and you know he's a bad doctor, a good doctor, he's a pill pusher, he's not, whatever. So you have to do all that research before you do that, you know, and then maybe you're lucky. You know, right? I had a skin condition. I tell you this is interesting. I've seen a person in US, I've seen a person in Canada, I've seen a person in Ireland. So, you know, where did I find the best doctor? Pakistan. And that's the one doctor that I can tell you amongst many, for a variety of reasons. She's a female doctor, amazing. So you need to find out, do your research. So it's really not confined to continent or just pure degree. Do you mean a good clinician who's good-hearted, who's willing? And the one thing you said, and this is the point I want to make. So I was recently at a conference. So the conference was about maternity and the baby and mom, that sort of thing. So it surrounded that theme. So the guest speaker was a senior psychiatrist, 40 years of experience. And he said, look, I don't have a written script here. I'm not going to do an introductory kind of thing and this and that. And I'm just going to tell you, I'm working for 40 years and I have met, and in Ireland, we do not have much, but we don't have a big, you know, other, I don't know if it's politically right to use that word here in this country, but they have a huge budget, but majority of it goes to health in Ireland, billions. So you would have a fantastic, I suppose, health system. But it's not, because my Italian friends tell me, gee, we don't want to go to Ireland because there's no waiting time, trolley time in Italy. They will criticize them. So the man says in his initial note, they said, I'm working for 40 years and I've done hundreds of meetings, budgetary meetings and all that. But I tell you one thing that can never be beaten and overcomes tons of hurdles is your goodwill and intention to work through a difficult problem. If you have that, you can get through that. So that is very, very important from a man who has 40 years experience, works with the Health Institute with billions of euros as a health budget, and has to come and tell us one thing and one thing only. And that was remarkable.
The good doctor
Dr. Javed, that's, I think.
Oh, here is there. Thank you. How are you? How are you? So, any questions? Any other thing?
dark picture here, Dr. Right? This dark picture में as a student क्या कर क्लास शुरुआत कर
See, I don't have a political answer. Just start where you can. Start from your neighborhood, like neighborhood support. Like, for example, elder abuse. I can tell you a story here. So this woman comes to look after my mom, and my mom has dementia. She comes to look after me. So she's a poor woman, lived in a very, I suppose, low-income area and all the rest. So she tells me a story, and obviously, alhamdulillah, we look after mom well. And she was saying that she's astonished that you can do that, but here is our neighbor. And she talks about her neighbor, that there's a couple there. They leave their father in the house. They lock the door from outside. They leave in the morning. The man shouts whole day long, probably starving, probably hungry, probably thirsty, soiled in feces and urine. And they come back 8 and 9. And she says, I wonder even if they look at him even then at that point. So there is a starting point. If you have a good neighborhood, if you look after, I think there's always a starting point. You can start whatever you see is wrong and start working, maybe building connections. Like, let's say if in your case, you go to Goat, Miti, what is the small neighborhood there? You can bring them together. I mean, small groups do work. For example, help cancer recovery patients, people who are hopeless. You go to who have recovered from cancer. They can come together and give up, because depression is very common in the serious illnesses and all the sort of thing. We need to have an initiative. People can work without money. That was the whole message that man gave us, that it's not all about money. It's also about, of course, you need a structure, you need all the rest of things. And that's where we need, go back to Dr. Iqbal, good representative who can work for it, but they are not. The thing about mental health is you may be doing disservice for you if you do not recognize your own mental illness. Mental illness can be invisible, because your suffering is visible to you. Let's say you have anxiety, it may be invisible to your family. It happens a lot of times that you're going through a tough time. They don't ask us. See, in our families, we don't ask each other, are you having a bad day? We don't ask each other. We don't have a habit. That's where you can start. We don't do it. We have become callous and apathetic. That's what we have become. So you start working from there, and it can change. We have to change individually, obviously, to change the society. But that's where the problem is. We don't say thank you. We don't say you're having a bad day. We don't ask our family, but are they having a rough time? We don't. That's our problem. Okay.
Thank you so much. One thing I want to add, try to find, I want to give you the answer, try to find that doctor who has a little bit time to listen you. Even he is a GP, he or she is a GP or whatever the person you find, मतलब कोई भी हो कि वो आपकी थोड़ी सी बात सुन ले, ठीक है ना? I'm practicing since 30 years as a gynecologist. I worked as a aesthetic physician as well, as a GP, as an alternative medicine practitioner. But I didn't give them so many medicine. मैं बहुत less prescribe करने वाली doctor since 30 years. Or just I did I am listening my patient.
But then again, you have to, but you have to waste money, the first appointment, before you find out. That was my point, that you have to go first and see, has he a listening ear? But you need to have expertise. Nothing can replace good training and education. You can have a good listener, like your mom may have a good listening ear, but she cannot do what a good trained clinician. So it's not one or the other. A doctor has to have all those components: good training, good education, empathy, and willingness to listen. But in realistic world, clinicians are too busy. That's what one thing puts off, because people don't go to the busy clinics because their doctors are too busy. A lot of research around that, particularly for the GPs, because your first port of call is your GP. That's where you go to, and then he directs it in a proper structured service system. But he will then direct you to the right service. And GPs are extremely busy to a point that patients actually think before they go into the GP surgery exactly what I have to tell. I have to tell him 3 things because he won't have time for 5 things. So they actually rehearse in their mind, sometimes elderly patients, and they come and apologize first. Oh, I'm sorry, doctor, I know you're too busy. And then they have to just, sort of blurt it out quickly so that doctor hears them, because doctor has 5 to 6 minutes. But there is also research that it doesn't have to be a lot of time. A lot of experience a doctor can pick up very quickly. And that's where listening ear is important, but clinical acumen, training, and dedication to profession, that works. The doctor that I went to, the skin doctor, she didn't have time. I think she hardly saw me, I can count 4 minutes. Yeah, I paid less, I got 4 minutes. I paid more, I did get it outside of Pakistan. So you can't just simply measure a good service in terms of time. That's what I'm trying to say. You need to look at everything. Yeah. All right. Yeah.
Mental health discrimination. If we talk about that, this group is strictly ideologically and religiously well aware.
What youth are talking about? Which youth you said? Sorry, yeah, yours, if you can use this. Sorry, say it again.
Sir, मेरा क्वेश्चन आपसे ये था, मेंटल हेल्थ डिस्क्रिमिनेशन जो आपका टॉपिक है उससे रिलेटेड क्वेश्चन है, जो आज की यूथ है पॉलिटिकली, आइडियोलॉजिकली और रिलीजियसली वेल अवेयर, और आज का यूथ जब वो रेशनली स्टडी कर रहा होता है कुछ चीज़ों की, तो एक ऐसी स्टेज पे पहुंच जाता है जहाँ पे उसके जो रिलीजियस डोगमास हैं वो भी चैलेंज होकर सामने आ जाते हैं, पॉलिटिकल जो बिलीव्स हैं वो भी उसके सामने चैलेंज कर आ जाती हैं, और पॉलिटिकली वो कुछ करना भी चाहता है, तो कुछ सिस्टम ऐसा है वो फॉलोअर बन चुका है, पर्सनली उसको मिलता है कि आपने फॉलो ही करना है, तो वहाँ पे जाकर वो कुछ नहीं कर सकता। तो उस वक्त जो मायूसी इंसान के अंदर छा जाती है वो बहुत बड़ी मायूसी होती है, जब उसके जो इन बर्थ इतने भी जो बिलीव्स थे वो सारे चैलेंज हो जाते हैं सामने। तो ऐसी सिचुएशन में पढ़े लिखे नौजवान से निकलने के लिए क्या तरीका होना चाहिए, क्योंकि डॉक्टर्स भी यहाँ पे फेल जाते हैं, डॉक्टर्स भी उसका मतलब
Okay, well, look, it's a loaded question, okay? It's not as simple as it sounds, okay? Your question is loaded. Okay, मैं ये तो नहीं कहूँगा betray, okay? But you can betray. Do what you want. That's probably a bit of a strong word to use, because I don't want you to go home and say, well, the doctor said betray, so I'm betraying now, and I'm going to do what I want. Like, to give you another example, I don't know if it was Monet, the famous French artist. I don't know if it was Monet or around some other artist from that time. So he came from a very, aristocratic families of lawyer, very rich Parisians, elite. And so the parents wanted him to be a lawyer, but he wanted to be an artist. And so he went his way. And I think there was then a few years down, there was a big show in the what you call them, there's a public building, I forgot, a national building, or every town has a building, I forgot the name, but so there's an art show there. So he put his painting there. So at this stage, he has told his parents that he's going to pursue his career in art and painting. That's what he wanted to do. And parents were strictly against it, because obviously that meant nothing to them, considering where their status was. So, but he did manage to get into that painting competition, and he was able to put his painting in the show. Tell me what, so there were almost 100 paintings or whatever. Where was he in that, do you think? Because he kind of followed his passion. What do you think where he was? Can you guess? Was he at the bottom? Was he at the top? Was he in the middle? Can you guess? Guess. Then no harm, no penalty in guessing. Where was he? No, bottom. He was the last. To his own humiliation. But he kept it. Now his paintings get sold. Obviously, that's the fate of an artist. You're more famous after you die, right? His painting is being sold. He's the father. So depends how much opposition can you take, but you still have to follow your path, because without commitment, interest, and dedication, and that's why we have lots of people, but none of them produce research here. We don't have people here who publish books, research. Why? Because we are the people who follow the income. Because Maslow's one, we need a house, we need a car, there are a lot of expenses, cost of living has gone up. You want a job that pays you, or do you want a job that you enjoy? And that's where the whole game is. If you're not really interested in something, eventually you're going to falter. Eventually something else is going to happen. Or you just be another Joe in the line of many Joes. You'll make no difference.
There are a lot of good questions, but time you have.
Okay.
अभी
I like that.
participant के लिए तालियां.
Okay, thank you very much.